Medicine is changing. It's no longer just about diagnosing and treating, but about anticipating, preventing, and repairing from the root. On one hand, personalized medicine tailors treatments to each patient's genetic, clinical, and environmental profile, and it already represents a growing share of oncology clinical trials in Europe. The market is expected to nearly double in value by 2030. Regenerative medicine, on the other hand, aims to repair damaged tissues using stem cells, biomaterials, bioengineering. As of June 2024, there were over 4,600 active clinical trials using stem cells. But some challenges remain. Regulations designed for traditional drugs are slowing the entry of new therapies into healthcare systems. Europe accounts for only 55% of trials involving advanced therapies, compared to 71% in the US. In addition, high costs and the need for specialized infrastructure make access less equitable. Despite these challenges, the future of medicine will be a unified strategy: personalized medicine plus regenerative medicine. This integration is redefining medical treatment and calls for new forms of international collaboration. At ARQUIMEA Research Center, we lead research lines that tackle current biomedical challenges from an integrated perspective. As part of the 𝐏𝐸𝐽 initiative, we're driving the future of innovation.